The so-called nose job is one of the first procedures that comes to mind when people hear the words plastic surgery. Of course, this is a side effect of the procedure's popularity today. Rhinoplasty and other nasal procedures are much more complicated and more important than that phrase, nose job, may indicate. That's why, among all the excellent content in the March 2012 issue of Plastic and Reconstructive Surgery, we're going to focus our attention right on the nose. To learn how rhinoplasties work in conjunction with unilateral cleft patients, I strongly encourage you to read this article on the long-term effects of primary and secondary nasal reconstruction in cleft lip and palate repair. Cleft lip nasal rhinoplasty is one of the most complicated things we do, so please join Dr. Court Cutting and his team as they investigate 116 secondary rhinoplasties in patients with previously repaired unilateral cleft lips. Beauty, of course, as they say, is in the eye of the beholder, but in our specialty, we're always trying to define beauty even further. In light of that quest, I urge you to read a groundbreaking study that aims to quantify the ideal nose. The ideal nose, in this case the nasolabial angle, which really is defined by this area right here. The existing literature says that this is between 90 and 120 degrees, which constitutes a good result. But in this first study of its kind, Dr. Guy-Aron and his group attempt to objectively define the ideal aesthetic nasolabial angle. Finally, we'll take a good look at how each patient's ethnicity can affect an approach to rhinoplasty. In the article by Roland Daniel, I examined the rhinoplasty procedure through the eyes of Indian American patients. The study's first group of patients had major concerns about their noses, including what constitutes a dorsal hump, their upwardly rotated nose, or a very large nose in general. This article indicates that for this population, the desired corrections may be different than what you'd expect. In reading this study, you'll gain an incredible insight into the Indian American rhinoplasty patient and their two primary goals: cosmetically enhancing their nose and preserving their ethnicity, which is really the gold standard for all ethnic rhinoplasties. The latest rhinoplasty literature should always be studied carefully to provide insight into both the reconstructive and the ethnic considerations. It is critical to consider the most important source, which is our patient. The scientific literature should always be used to increase your understanding of your patient's desires. If you do that, a rhinoplasty will never be a simple nose job. Until next time, we'll keep our noses to the grindstone to continue to bring you the best of the best science in plastic and reconstructive surgery.